Depression is a common disorder affecting children, adolescents, adults, and the elderly. 1 in every 5 people experience depression at some stage of their lives. Despite opportunities for identification and the availability of effective treatments, the majority of depressed youth and adults, however, are undiagnosed and untreated. The degrees of suffering and disability associated with depression are comparable to those in most chronic diseases and also associated with serious long-term morbidities and risk of suicide. There is now a growing evidence to support screening for depression among children, adolescents, and adults. In addition, depression self-monitoring is now recommended by various studies and associated with decreasing depressive symptoms. A recent Australian randomized control trial in 2012 that examines the effectiveness of mobile phone self-monitoring program for depression found that depression self-monitoring increases emotional self-awareness, which in turn decreases depressive symptoms for young people with mild or more depressive symptoms. Therefore, early detection and self-monitoring can play an important role in a person's long-term outcomes. In June 2012, we reviewed all the available depression-related apps in Apple's store and found 3 apps that provides depression screening tools. 2 of them are targeting healthcare professionals. None of the identified apps are designed to monitor the user's progress. Our aim was to develop an app that can be used for screening as well as self-monitoring, that is easy to use and utilizes a well-validated depression screening and monitoring tool. The Patient Health Questionnaire, PHQ-9, is a diagnostic tool specific to depression that is well validated in various settings for screening and monitoring. It is also a very short compared to other tools. Moreover, no permission required for reproducing, translating, displaying, or distributing the PHQ-9. Therefore, the PHQ-9 has been selected to be used in Depression Monitor. Depression Monitor is an app where users can complete the PHQ-9 questionnaire multiple times and monitor their progress. It also accompanied with extra functions that facilitate its use. Depression Monitor utilizes the Health Monitor template. To know more about the Health Monitor, please visit www.shproject.net. In our app, Depression Monitor users can complete the PHQ-9 questionnaire multiple times, and each time they fill it out, they will receive a depression severity score based on their answers, along with an interpretation of the score. User scores will be saved in the results section in 2 formats: A list of scores by date and time, and B, a line diagram that shows users their progress in a graphical format. Users can set up multiple alarms with 3 different frequency options to remind them to take the test regularly. Users can send their history via email to their therapists. Thank you for listening. We will leave you now with a video demonstration of how Depression Monitor works.